Well, Dan, I've got a really cool interview coming up. Today at 4, we're continuing our conversation on the gender wage gap here in Utah. Women make less than men in just about every occupation, and that gap becomes even more drastic when it comes to STEM fields. Dr. Denitza Blagev, a pulmonologist with Intermountain Medical Center, joins us now to talk about her experience in a STEM profession. Welcome back to the show. We've had you on many times.
Thanks for having me.
And usually we're talking about something that really involves your career. Today we're talking about your personal experience. What do you think when you hear the number 77 cents to $1, what women make compared to men? What goes through your mind?
You know, obviously one of the things is that it's really unfair, and I think from looking at the numbers too, I think Utah seems to be the state that sort of leads in terms of having the biggest gender gap. Yeah, so I think...
Yeah, and being a working woman, as I am as well, we experience that in the work field. Let's back it up to your schooling. Let's go back to your collegiate courses and even in medical school. Did you see that gap as far as the population in your classes?
Yeah, you know, that's an interesting question. Definitely for science, and depending on which science or math classes, it was pretty typical to be one of very few women in those classes. Before going to college, I actually went to a boarding tennis academy where in competitive sports, it was also pretty typical to be sort of, you know, one girl with many boys around and competing. So I think to some degree that helped me be used to it, but it's certainly something that's very prevalent. I think even at every level, you know, for example, my college class was more women than men, but in the science classes there was a clear difference.
Right.
And then through medical school, I don't think there was a big gap between the number of men and women in my medical school class, but the surgery rotations, or specifically sort of the attending surgeons or the senior physicians, and depending on the specialties, there were often quite large gaps in terms of having very male-dominated fields.
Well, this question is part of that big debate. Do you feel like, and this is for you personally, do you feel like being a woman, your gender, held you back in your career? Did you feel like you had to work that much harder, or was it not a factor at all?
You know, it's hard to see it on the individual level. Definitely there were things that have improved the more advanced as I've advanced in my career. But for example, as a medical student or as a resident, so as a trainee, if you're a woman standing, you know, if you're the woman resident standing next to the male medical students, more often than not, people turn to the male medical student assuming that he's the one in charge.
I see.
Similar, you know, and I've had a lot of friends who are physicians who sort of note the same thing. You know, the anesthesiologist will say, yes, the surgeon will turn to the male medical student thinking that he's the one in charge. Patients assume the same thing as well. So, you know, you're often mistaken for the nurse or the social worker or somebody other than the physician who's taking care of that patient, even as you introduce yourself.
As being the doctor.
Yes. I think some of that has changed, and I'm sure some of it is just as you get more advanced in your career, sort of that confidence and everything, you can overcome it, and people are more cognizant of sort of who's the doctor and what's happening. But definitely early on, there are perceptions that people sort of assume that this is the person who seems like they should be a doctor, and this person must be somebody else. And
you just mentioned what seems to be like that societal norm that women are nurses and men are doctors, and that's just how it goes. How do we change society, kind of looking forward in the future? How do we change that phenomenon?
It's a really good question. You know, I have 2 6-year-old boys and a 4-year-old boy, and I'm a doctor. My husband's a doctor. Our pediatrician is a man, and all the nurses in his office are women. And when we were there for just a routine visit, one of my kids, I think when he was 3 or 4, turned to me and said, "Oh, Mom, I figured it out. You know, men are doctors and women are nurses, right?" And he's the child of a doctor. So I think there's certainly a lot of ambient culture that they get socialized about what certain people look like or what they're supposed to be doing, what their roles are. And I think now their view is a little more nuanced, that even when I say, oh, but women can be anything, they'll say, yes, but, you know, most surgeons are men.
Right, right. And you say, look at mom, look at me. I'm a woman, I'm your mom, I'm a doctor. All right, so it sounds like we have to continue that conversation with our kids, start it when they're young and have it throughout. Dr. Denitza Blagev, Dr. Denitza Blagev, thank you for joining us.
Thanks for having me.